Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Today's research paper appeared in the journal Federation of American Societies for Experimental Biology. It was in July of 2015, but it was a groundbreaking human study showing the effects of certain supplements on preventing key aspects in Alzheimer's disease development. So because there is at present no known cure for Alzheimer's disease, prevention is considered a first-line defense against this mind-robbing disorder. Now, one of the hallmark features of Alzheimer's disease is the presence of beta amyloid plaque buildup in the brain. So beta amyloid plaque is not only a feature of the disease, but it's thought to generate free radicals that actually speeds up the progression of the disease by destroying even more brain cells. So there have been some previous studies to show that certain omega-3 fats, especially DHA from fish and fish oil, can decrease the production of beta amyloid plaque in the brain. As well, population studies show that those who consume the most omega-3 fats over their lifetime, in the range of about 500 milligrams per day, have a lower risk of Alzheimer's disease as they get older. And other studies have shown that when Alzheimer's disease patients who are in the early stages are given 2,000 IUs of vitamin E, it has slowed the progression of the disease, either by itself or when used in conjunction with standard Alzheimer's medications. So this study that I'm referring to today by Milan Fiala from the University of California, Los Angeles, and her colleagues investigated the effects of supplementation with omega-3 fats and antioxidants in 12 patients with minor cognitive impairment, 2 patients with pre-mild cognitive impairment, and 7 patients with Alzheimer's disease. And the study lasted from 4 to 17 months depending on the patient that was involved. So their study showed that supplementation with omega-3 fats and antioxidants prompted certain body immune cells to ingest and destroy beta amyloid plaque in the brain at an increased rate. So certain white blood cells known as monocytes, upon omega-3 fat and antioxidant stimulation, they began digesting and breaking up the plaque in the brains of these patients. So the net result was less beta amyloid plaque in these high-risk patients. Now, the patients who already had Alzheimer's disease showed a much reduced effect. So the efficacy was much greater for those with mild cognitive impairment and pre-mild clinical impairment. In other words, those with early stage memory loss who did not yet have full-blown Alzheimer's disease, they showed the best results. So the study authors concluded, our study is the first to show significant immune and biochemical effects of omega-3 fats with antioxidants in patients with minor cognitive impairment. So the takeaway message from this seems to suggest that omega-3 fats together with certain antioxidants may help to prevent the buildup of beta amyloid plaque in the brain. Now, this outcome is something we should all strive to achieve as a means to prevent Alzheimer's disease, and it may be especially important for those who already have early stages of memory loss or mild cognitive impairment. So this study builds on some of the previous studies that we've seen before that suggest similar benefits from omega-3 fats and certain antioxidants in Alzheimer's disease prevention. Now, in this study, the participants ingested a smart drink that contained 1,000 milligrams of DHA, 1,000 milligrams of EPA. These are fish oil essential fats of the omega-3 variety. And the drink also contained antioxidants from pomegranate juice, chokeberry, and resveratrol, and it also contained 400 IUs of vitamin D. Okay, I've included a link to the research in the text below, so thanks for watching, and I'll see you next time.